Well, hello, everyone. I'm Aashima. I'm thrilled to be here today with my dear friend, Dr. Michael Schlosser, the Senior Vice President of Care Transformation and Innovation at HCA Healthcare. Welcome.
Aashima, thanks for having me. Today, we want to share how Google Cloud and HCA Healthcare are partnering to harness the power of generative AI to elevate clinical care and ease the burden on healthcare teams. So let's start with the goals of the collaboration.
At Google, we see the potential for AI to help address major issues in healthcare. Things like staff shortages, documentation burnout, and the mountain of administrative tasks that pull clinicians away from patient care. Our goal is to develop AI technology that supports clinicians by augmenting their abilities.
At HCA Healthcare, we're committing to finding innovative ways to improve care delivery. This collaboration is about aligning Google's cutting-edge AI with HCA Healthcare's on-the-ground knowledge and clinical knowledge and expertise. This will help us create impactful, meaningful solutions tailored to the real needs of patients and care teams.
Working closely with Dr. Schlosser and his team has been incredible. This collaboration has ensured we are building the technology solutions that are focused on the right priorities and challenges for our partners. We ground our AI technology in real-world use cases. And with MedLM on cloud, the generated responses are secure, they are private, they're permissions-aware, and all this equals to enterprise-grade GenAI. We have always taken a human-centered approach to AI in health.
For HCA Healthcare, these priorities focus on improving operational workflows for care teams and driving a more seamless patient engagement. We've been exploring the capabilities of MedLM to solve these real problems. Using MedLM, we have automated things like documentation, summarizing insights from medical records. Most important to this process, we're putting our clinicians at the heart of this innovation, giving them a voice to tell what they need, including them early in the testing process. When we first showed MedLM to members of our care team, we heard a resounding feedback that this could be extremely valuable in supporting part of the care process that has been an issue since the beginning of healthcare, the nurse-to-nurse handoff, sometimes commonly known as the bedside shift report. This handoff occurs when one nurse reaches the end of their shift and they have to hand off and transfer critical information about the patient to the next nurse coming on. This step is vital to patient safety and is done with printed, digitally hard-coded reports, manual processes. Apart from noting the standard data like vitals and allergies, it also relies on the nurse's recollection of events and conversations and data points that they consider relevant to be transitioned, like how the patient slept or how often they asked for medications. So we asked ourselves, how can MedLM optimize the nurse handoff, consolidating volumes of patient records into one succinct, logical, and maybe even intelligent and interactive handoff process? And right now, we're working with Google and MedLM to build a tool that does exactly that.
MedLM's capabilities can be used to analyze patients' health history, clinician notes, and more to create a comprehensive, easy-to-use summary for the handoff. A nurse then reviews the note, confirms its accuracy, modifies as needed, and hands it over to their counterpart. This helps nurses quickly get to the information they need, giving them more time to dedicate to patient care. And it's how we are taking AI from research to reality.
And so this is all very exciting and it's moving very fast, but we believe in the need to go slow to go fast. And so let me explain that. With the right risk-based framework, which allows selection of the right use cases, the right data sets, and the right approaches, we'll be able to quickly learn how to use and deploy AI in medicine. We have strict protocols around AI development that prioritize safety, accuracy, and always keep clinicians in control, a human in the loop. As Aashima said, these technologies are meant to enhance care teams, never replace them. Our collaboration highlights the power of partnership in pushing the boundaries of healthcare innovation in a safe, equitable, and ethical manner.
But we know that we are early in our journey, and we want to ensure that advancement of these new technologies happen with healthcare and not to healthcare.